So thank you for joining this new edition of EU-JAMRAI Tuesday Connect. So without further ado, I will now give the floor to Claude Mabilat, who is representing MedTech Europe today. And Claude will present a nice overview on medical technologies and how they can power Europe's fight against AMR. So Claude, the floor is yours.
Good morning, everybody. I'm very pleased to be with you today, especially on behalf of MedTech Europe and my colleagues. So I'm very honored to be invited. We are honored because we're a group of companies, actually. And the goal of today is really to introduce you to what we do and how we can help EU-JAMRAI to achieve its goal to fight against AMR. The agenda of today is the following. We're going to speak about MedTech Europe. What is it? And what are medical technologies? And then we will see the role of their role in the medical technology industry. What is the role of our industry in curbing AMR and HAI, which stands for hospital-acquired infections? How we can contribute to this fight? And our call to actions and the relevance to the activities of EU-JAMRAI 2. And then there is a session of question and answers that you are welcome to ask. So first slide is about MedTech Europe. What is MedTech Europe? I can't see, sorry. I will do a small manipulation. Here, yes, I can see now. So this is a trade association for the medical technology industries, which represent the industry of diagnostics, medical device, and digital health. So our mantra is from diagnosis to cure, and our members are multiple. We have more than close to 200 multinational corporations and we represent more than 50 medical technology associations. Okay, so the purpose, just put that here. Yeah, the purpose of medical tech, sorry to these technical details. The purpose of our association is really to make innovative medical technologies available to more people, with helping the healthcare systems to move toward a more sustainable pathway. So we'll see how it does translate for AMR and AMS. The mission is to be the European voice of our industries in Europe and beyond, to facilitate access to needed medical technologies for the one who needs the most, and contribute actively to the policies and regulation in EU. We want also to highlight the value and contribution of our technologies. It's not only technologies, it can be also services and solutions for the patient, for the healthcare systems, and for society. We want to be a trusted partner to EU policymakers and key stakeholders, and this is achieved through fostering the highest ethical standard in this domain. So, to show the impact of this association of industries, it represents close to 1 million employees in Europe, and the contribution to society is as much as the pharma industry. You can put a number onto that. It's all close to 200,000 euros of added value per employee. So it's an important social and economic contribution for EU. We generate a 5 billion trade surplus at the European level. So we contribute to EU competitiveness and resilience with more and more exports. We represent 38,000 companies. Most of them are 90 SMEs, sorry. If you remember the 170 figures before, it was big companies. So you can see that there is a big gap. There is a very different type of companies in the association. And we sell then 2 million different commercial reference of medical technologies, which is huge. So nothing to compare with the pharma industry. Of course, we care for patients, first of all, and we help healthcare professionals and improve the sustainability of healthcare systems. So the medical technologies are there are three pillars. The first one is medical device, second is in vitro diagnostics, and third is digital health. Any technology is used to save and improve the life of individuals suffering from a wide range of conditions. And once again, we are not pharmaceutical companies. We complement their activity. We do not sell drugs, we sell technologies that accompany the treatment of patients. So if we make a focus on in vitro diagnostics, what is it? This is non-invasive test used on biological sample, like example, blood, urine, tissue, to determine the status of a person's health. And they generate information to determine the best way to treat the patient, basically. So an example of IVD on the right side is the isolation and identification of bugs and antibiotic susceptibility testing of bacteria, DNA genotyping and analysis, inflammation markers like CRP in point of care testing. Uh, the other pillar is medical device. Once again, there are innovative technologies that are available to hospital, physician, and patient that save lives, replace and restore body functions, prevent disease development, monitor patient conditions, and so on. So example on the right side are personal protective equipments, surgical tools, gloves, tables, disinfection solutions, hospital beds, mattresses, sheets, and so on. So it's very diverse, as you can see. And finally, digital health solutions. I don't think there's a lot to be said on this. You know, all know what is information, how important it is in managing the patient condition, the patient condition. And so it's all to do with the technologies managing the information to improve prevention, diagnosis, treatment, monitoring, and management of the health of the patients, and eventually the lifestyles when the patient are discharged. So the role of medical technologies sector in curbing AMR HAI. So as we all know, we are all facing the pressure of a shifting world, especially our society. Uh, we have an aging population and workforce. There are increasing chronic diseases, increasing health costs. The progress of medicine is very nice, but expensive too, so we have to manage that. And there are a number that are exploding, and you have to manage that to take the best value out of them. So the role of medical technologies in that context, and especially for AMR and HAI, is first of all to prevent. And we have device and solution like microbial screening, antimicrobial dressings, automated disinfection, surveillance software to help prevent and control hospital-acquired infection through the patient pathway. So by doing so, we can avert more costly advanced care, enabling more efficient resource use. So that's one, prevention. Second is detection and diagnosis. Here we have rapid and molecular diagnostics, which enable appropriate and targeted antibiotic use, especially critical in community care settings where most antibiotics are prescribed. So once again, early detection and susceptibility testing improve patient care and help saving costs globally. Third, you have surveillance. You all know that in EU-JAMRAI, how surveillance is important. So we have systems, platforms, CDSS that support this activity. Early warning, avoid unnecessary costs. And finally, we support innovation with advanced diagnostics and drug discovery technologies, which are essential for the development of new antimicrobials and therapies. So why are we here today? Well, MedTech Europe is a stakeholder of EU-JAMRAI. Maybe you know it or don't know it. So it's the place to get us known by the community of EU-JAMRAI. So what we do here is that we are learning, we are listening to what you say from the different working groups. So Vienna was a nice example to see what are the key priorities for fighting AMR in Europe from your point of view. From our point of view, we can provide insight, sector-specific insights, and contribute to shaping efficient action plans because we have a lot of expertise, we have perspectives, and we have resources too, which are very complementary. So that's why we can engage in common AMR-related policy, advocacy, or implementation, all this to reinforce the initiatives from the different work packages. So how can we contribute? There are four pillars that I'd like you to understand. First of all, we have technical expertise and concrete solutions. And this is coherent with EU-JAMRAI, which explicitly requires practical solutions to strengthen IPC, surveillance, antimicrobial stewardship across member states, an area where MedTech Europe is, of course, naturally aligned. And we can, the members of MedTech Europe can provide proven solutions available aimed to reduce HAI risks and improve antimicrobial stewardship. I won't go into the detail because I have more examples after, but you can read them. Second point is about capacity building. The joint action recognized that many member states lack sufficient human, institutional, and technical capacity to fully implement the One Health AMR policies, even when the NAP exists. So on our side, we can respond to unequal implementation across countries. Our members can contribute to the joint action by raising awareness on existing and innovative solutions. We can help sharing international best suited practices in prevention and diagnostics. We work with a lot of different healthcare professionals and gather information. And also we have training, education, and awareness activities that could be useful. The third pillar is evidence, data, and field feedback. So here, EU-JAMRAI aims at strengthening the One Health surveillance and enhance the uptake of innovative IPC and IMS interventions in the field practice. And what we can provide is, on our side, evidence. We can provide data, field insight on the performance, users, and impact of our technologies that support these programs. Finally, on the policy level, the adoption of the EU-JAMRAI recommendations require advocacy and stakeholder alignment. And naturally, MedTech Europe can be a policy partner because we are already we are already in an open exchange with a range of European stakeholders, and we can help amplify the recommendation and goals of EU-JAMRAI too. And for you to know what you have listened up to now is very medical, but you have to know that we also serve the other One Health sector with adapted solutions. Some of us have solutions for the vet, some others have solutions for the environment. So it's nice to talk, but it's better to show evidence. And we built a mini website on our website for MedTech Europe dedicated to cost-effective medical technologies for supporting infection management. And I'm going to switch to the site itself. If I click, it should work. Yes, so I'm now live on the site. And so I encourage you to go through it and discover how our technology supports the patient pathway in the hospitals. So before the admission and in the community, you can use different technologies like pre-surgical nasal screening, point of care, streptococcus A pharyngitis test. So this shows the patient pathway entering the hospital. So before the hospital, you can use different technologies. I was citing a different type of screening, etc. For each of them, we make an illustration. It's just example which of technologies which are given to illustrate this support and the benefits of our solution. So you can click on one, let's say CRP, and you can use this technology to avoid prescribing an antibiotic. More specifically, it has been shown to significantly reduce antibiotic prescription for lower respiratory tract infections and generate cost savings up to 33 here it's in pounds per prescription avoided. So you can illustrate that for all the steps of the patient in the hospitals. At the entrance of the hospital, you can use, by example, multi-drug screening organisms techniques like chromogenic media, which are an old technique but sophisticated anyhow. And by doing so, a cost model showed by targeting screened at-risk patient at admission, combined with a dedicated style for identifying carriers of carbapenemas producing Enterobacter S, that was the most cost-effective intervention to control the spread of CPE. So it's very important for, as you understand, for infection prevention and control. So it justified the additional 17 euro because it's much less than to have a CPE acquisition in the hospitals. So I encourage you to go through all the technologies. We won't go into all the details, but we have in the operating room antibacterial shutters, active patient warming, impregnated incised drape. You can find evidence also for during the hospital stay for rapid identification of bloodstream infection pathogen using mass spec or PCR technology, biomarkers, clinical decision support software. And even when discharged and back at home, we have technology like wound care management to avoid surgical site infections, complications, and medication monitoring, and so on. So I will go back to the slide. So I will stop to share here and share my slides. So now what I'd like to finish with is to state our call to action to fight against AMR. This is the call to action of our working group on AMR and HAI, and show you that is really relevant to the EU JAMRAI goals. So our goals is divided into five asks. And I go through all of them and show the relevance to what's going on in EU-JAMRAI. So the first one is to prioritize the reduction of HAI. So what we recommend is to promote, of course, the implementation and uptake of these medical technologies, including hospital and in community care settings. And an ask for us is to lower the barriers for the adoption by facilitating reimbursement schemes and value-based procurement so that access can be done for everybody. And this aligns with EU JAMRAI 2 WP5 policy and app development suggestion for concrete country adaptable measures. Another ask, number two, is to expand the access to rapid diagnostics, including point-of-care testing, to promote the equitable access by introducing, by example, early adoption mechanisms in healthcare systems, evidence-based adoption, and targeted incentives. So what we do suggest is to secure the policy maker support, is to establish a harmonized European framework for diagnostics value assessment that incorporate not only the patient benefit, like is done today, but the indirect benefit generated by testing rapidly an infection. And this is illustrated by a framework model from the Office of Health Economics of London to illustrate what type of benefits can be generated, a population benefit generated by specific diagnostics, not only for the patient, but also for society. And this aligns closely with EU JAMRAI Work Package 9 on improving access to critical AMR-related products and underscore the need for stronger integration of diagnostics. Today, it's about antibiotics, but what we recommend is to also integrate diagnostics. Number three ask is to leverage technology for antimicrobial stewardship. So it's an easy sell within EU JAMRAI, particularly for the need to strengthen integrated One Health surveillance. Uh, we also recommend to invest in innovative technologies and enable new antibiotic developments. At the same time, so it looks quite obvious to have these new tools to prevent infection, guide appropriate antibiotic use, but it needs to be adopted, understood by decision makers, and these people requires more and more robust, cost-effective evidence to justify developing such innovation within constrained national budgets. So it's important that we bring to the table a strong health economic perspective in discussion with EU and national authorities. And here at MedTech Europe, our companies are well positioned to contribute because what we do, not every day, but very regularly, is to engage into market access and health technology assessment processes. And we can collectively help shape the narrative for JAMRAI intervention, including IPC and IVD solutions. So we recommend that for the future JAMRAI activities, not the case today, that this activity explicitly integrate these health economic dimensions for adoption of recommended interventions. Number five is to foster integrated approach by promoting the harmonization of AMR plans and data collection across healthcare systems, fully aligned with the One Health approach. So we as MedTech Europe members can actively contribute to this by proposing pilot sites for evaluating IPC in diagnostic technologies, at least on this technological side, and help define practical implementation framework. We're used to do that for our product. We can help for specific interventions. By doing this, we put the emphasis on harmonized, integrated approaches, directly reflects the EU-JAMRAI priorities, which call for concrete actions, pilot programs, and capacity building. So I'm reaching the conclusion. So what can we do as MedTech Europe? What can we bring to EU-JAMRAI 2? Well, we can provide essential technological expertise, practical implementation capabilities, as well as educational resources. And we think we're a unique bridge between industry, healthcare systems, and policymakers. So we can provide structured recommendation aligned with European AMR policy priorities, so that in the end, EU-JAMRAI can therefore rely on our association to help transform policy intentions into concrete actions. And if you want to know more, because it's a short presentation, I know there's a lot, so I recommend you to connect to the different link when you're going to have the presentation after. That tells you a little bit more of what was presented today. So on this, thank you very much for your attention, and we're ready for the Q&A, I guess.
Okay, thank you very much, Claude. It was a very effective presentation indeed. I wanted to know one thing. You were mentioning the One Health capacity of MedTech Europe to contribute to EU-JAMRAI. I was wondering how many members of your association are not only in human health but also proposing solutions to environment or animal health.
Well, not that much, but there are a few companies that have a product. I'd say out of the 80,000 companies, let's say 10, 20, 30, something like that. So if you're interested, what I would recommend is that you contact our office, and then we'll discuss with the most relevant members, what type of solutions they can offer in the field. Yeah.
But despite this, well, I would say rather limited number of members, more generally, MedTech Europe and its members and the working group is in capacity to translate the knowledge and the day-to-day work into a One Health approach, as you mentioned.
An example is that the AMR surveillance surveillance in general is a typically transversal activity. So data from the hospitals, data from the community, but also data from vet and the environment can be collected in the same tools, or assembled in the same data pipelines.
Thank you very much.
Anna, please.
I had precisely the same question as Richard, because I work on animal health. So we have what is called StarIDAS. So StarIDAS is a kind of a network that puts together researchers and funders. So I'm not sure if you're members or not, but it will be interesting if you also have activities on animal health that are transferable to animal health settings. Then we will welcome if you can liaise with us as well. Thank you.
What I would recommend, Anna, is that you contact us after for the secretariat,
Okay.
and we can discuss what can be done.
Thank you so much.
So I was also curious. It's a question a bit following the one from Richard and Anna. But what kind of technologies, because you described quite a lot of technologies in the human field, but what kind of technology can you provide to the vet and also the environmental field, and whether there are some very different specificities, let's say, for these technologies, since they are not reimbursed, and for instance, vet have to to cover the whole burden, economic burden of the tools.
So what I can say that the technologies are the same in terms of technologies, the products are not the same. So there's a big difference between a technology, culture, PCR, immunoassay, and a product. A product is to be used in the field. So you can imagine that the hospital is very different from the farm by definition. So it's not the same specification of the product. Even if it's the same technology, it's not the same specification. So the cost of good, the way to use it, the stability. So there is a lot of different specifications that are different. So then it becomes a business matter. So is it worth investing to do this in the in vet or in the environment? So far, to give an example, not to cite companies, but there has been antibiogram, specific antibiogram for the vet fields. Leveraging the existing systems for humans. Susceptibility testing can be generated for vet, for horses, for cows, and so on. So the same platform can be used provided that the antibiotics for animals are present in these solutions. So there are several solutions. We won't discuss that here, but yes, it's adaptable sometimes. Yes.
Thank you. We have another question in the audience.
Yeah. This is Hossam, Digital Health Manager from Baxter. Thank you for the presentation, and I have a question about financial side. How far can financial side support for hospital go, and are there European funding programs to finance innovative projects such as the software or applications?
Yes, there are innovative schemes depending on the countries. It's national. In France, for example, we have RIHN, which stands for a limited in time reimbursement of innovative technologies, just to see. That's the idea, if it's worth it, so to speak. But it all depends on the country. So it would be nice to harmonize that at the European level. So that's one. And now, if there is your first point was about economic evidence or funding for new innovative technologies.
No, funding.
Funding. So it's,
Yeah.
I guess I answered that. So there are
Yeah.
European programs, but national. It's when it's come to diagnostics and medical device, it's more about national mechanisms of trials, so to speak.
Okay, thank you.
I also invite you to check the last Tuesday Connect, where a project about innovative procurement has been presented. So it can also be a way to secure innovation and to secure products in hospitals. So please have a look at the Radar PPI project.
Radar, yeah, correct. Yeah, that's one of them.
I was wondering with which main units or general directorates from the European Commission and European agencies MedTech does work more regularly, and is there a frame for such interaction, and what kind of interaction frequency and so on?
Yeah, I'm not specialist on this. I know we have a working group dedicated to that, public affairs. They interact with several divisions, that's for sure. It's not one, it's several. But then I can connect you with a relevant working group, which is used to do that.
Thank you.
I encourage you also to contact our secretariat if you have any pending questions that you might think are just after. We're really open to the discussions to help you.
Maybe I can make a comment on health technology assessment. So yeah, I know it's a critical question, but also tricky one, since it's often it's a national mandate. So there were some joint activities in a joint action on HTA, but yeah, it's really a tricky question, and there are more and more evidence on the importance to include indeed other parameter in the assessment. So I hope in the future we can convince national stakeholders to make the effort, because it's often resistance to change.
Yeah. And this is typically a synergy we could have together, because it's the interest of both EU-JAMRAI and MedTech Europe to increase the access to the product that everybody needs. And it's true that we can push for a harmonized HTA would be a great progress, instead of having to deal with 27 different, organization. To deal only with one would be a great progress for access.
Yeah, there was this project, but I have to say that I don't know what were the results of this joint project on.
It's ongoing. It's ongoing.
It's ongoing. Yes. Okay. So looking forward to the outcomes of it, and maybe a second comment. And well, it was mentioned in your conclusion call to action, but I think digital health solution supporting data sharing and data interoperability is really crucial now. Of course, for surveillance, but also for in the hospital, for to facilitate the management of patients. It's really crucial, and I think often underestimated. So I'm happy to seeing it mentioned in your call to action, and I think we can also support here.
Yeah, and I can bring here a testimonial. One of the companies, or several companies, have CDSS managing antimicrobial stewardship. But the implication of that is to connect the pipeline of the lab, the pipeline of the pharmacy, the pipeline of the HR, and sometimes in hospitals they are not, they don't share the same format. They are not compatible. So it's a huge task. The first task when you implement one of these solutions for IMS support is to connect that's the most challenging task, to connect all the information systems coming from the different entities in the hospitals. Yes. So there is a lot to be done there.
Yeah, and also between hospitals. I can tell in France, each hospital has its own software, and it makes
which is
the
fine,
situation.
but it's just a standard. Interoperability is really key to the same standard for everybody is absolutely key.
So if there is no other question, oh yes, Richard.
I'm sorry, I don't want to monopolize
Pleasure.
the floor, but as you know, the JAMRAI is composed of the participation of the 30 European countries, and national and local situations are quite different from one region to another, from one country to another. I was wondering to which extent MedTech members, at least, are engaged in in the less favored region or countries in Europe in the domain of AMR, because we all know that some countries are much more advanced in reducing the AMR threats than others. And well, I was wondering to which extent you have a mapping of this engagement in the field.
I'd say we're everywhere in every country. What the big difference being the level of maturity of the healthcare system by country. So we will not provide the same solutions by definitions in one country or another country. Yes. So it all depends on the structure of the healthcare systems, the level of funding they can get, etc. So, but we have let's say thousands of different references. So for the same function, we can provide different solutions. So it depends of the the cost is related to the performance of the system, so it's more lengthy, it's cheaper but lengthier, or it's more expensive but more rapid. So it all depends on the context. Yeah.
Thank you.
But we sell in Romania, in Bulgaria, etc. That's no problem.
Continue my reflection, and do you have other connection or coordination with other industry association which are also active, but on AMR reduction? but through other services, products, solutions? Does it exist, or do you
Yes,
have?
yes, of course, we do have links, like, by example, with pharmaceutical associations. Yes, yes. So there is possibly some synergies if this is your questions. Yeah. Mm. Yeah. Once again, it's to be handled with we have a working group, a public affairs working group, and that's the place to discuss. Yes. Mm.
Thank you.
Thank you. So I think we will close the meeting. So thank you, Claude, for presenting and for this really nice demonstration. I hope it will inspire people to contact MedTech Europe and pursue some implementation in the field, in the ground. So I would like to recognize also that medical technologies, and especially diagnostic, but not only, are really core elements of stewardship and IPC. And I have to acknowledge that this is maybe not sufficiently addressed within JAMRAI at the moment. So if we can support and endorse some message with you, we will happily do it.
In the meantime, thank you for inviting us, and once again, we are very open to discussion to the different working groups of EU-JAMRAI.